So, jumping right in, talking about the beginning of shift. And if you've done ride times, you know how it is where you see the crew coming off, the new crew coming on. They kind of have this exchange where they talk about, hey, this is what we ran yesterday. This is what we might have used. And it is your responsibility as the new paramedic or EMT that's coming on today to check out your equipment. Checking out your equipment, it should be methodical, right? We should have a list of everything that's on that truck, and we need to make sure that everything is restocked. Because if it's not, and you get the call, whose fault is it? I know you're going to try to blame the guys and girls that just came off, but it's ultimately your fault because you're the one on shift. You're responsible for that equipment. You need to have PPE on your apparatus that meets all criteria for any type of call. So if you're on an OB call, you got to make sure that there's gowns on the truck, respiratory, or something that could cover your face, your eyes, your gloves. Either if you're using gowns or trauma sleeves, you got to have everything on there. And again, it's your responsibility to make sure it's there. Let's take a look at these levels. So let's take a look at level A first. Level A has to do with the greatest or the worst contaminants, right? It's going to be contaminations to respiratory drive, contaminations to your skin. This is a full encompassing suit that you see up over here on the top left. It says that it's chemical resistant, and at the end, you just throw it out. That's level A. Level B is very similar, except that it's not like fully encompassing. You actually have a SCBA on your back. Instead of inside the suit, it's behind you, right? Just kind of like a firefighter in bunker gear. They have the SCBA on their back. Very similar in a level B. Not as much skin contaminants as there are respiratory contaminants. So if the test question tells you that it's only respiratory only, we can use level B. With level C, we see that the airborne substance is known. We know what's out there, and we can wear an air purifying mask, kind of like an N95 or whatever they are providing for that air purification. Again, it's very similar to the level B minus the SCBA. That's all it means. And then level D, the most minimum sort of protection to these contaminants out of the level A through level D. Typically, it has eye protection, a hard hat, gloves, things of that sort. That's what you see over there on the right-hand side.